neurology goes way back. So even in Stone Ages, there are skulls that have trepanation done to try to relieve pressure from the brain. And most of these pressures in the brain was likely due to parasitic infections, which were common early on because of the impure waters. And the papyrus from Egyptians also have details on meninges, have details on how to do trepanation and how to drain water. They knew about CSF, they knew about floating of the brain, they knew about bleeding inside the brain. And then one of the earliest descriptions of treatment of tremors and neurodegenerative disorder comes from Vedic text from 2000 BC or so, talking about neurological, including epilepsy. So there was a lot of work written on epilepsy in Vedic text and Parkinson's disease. But earlier, modern neurology started by understanding of the anatomy. So Galen was the most famous surgeon who was doing autopsies in Roman era. In the public square, he will lay down animals, he will dissect them and show them different anatomy parts. And one of those anatomy parts was, of course, nerves. And he became famous in the square because he will dissect the recurrent laryngeal nerve of the animal, which was screaming because of the dissection being done without any anesthetic, and the animal will stop screaming suddenly. Actually, he will be screaming, but you cannot hear the voice anymore. And that was the recurrent laryngeal nerve transection that can still happen in thyroid surgery and cause the same problem. 1543, Vesalius drew extensive pictures of the brain in his anatomy text in 1543. And then in 64, the British physician internist in Thomas Willis described the circle of Willis, or blood supply of the brain. And that's how gradually the birth of neurology happened, from Galen to Vesalius to Willis, and then Duchenne, a French neurologist. French were really the fathers of neurology. So Duchenne did a lot of work on nerve stimulation, nerve conduction studies. And then Romberg was a German neurologist at that time, talking about muscles and coordination. And then Charcot started a center in neurology, which was in French famous La Salpêtrière Hospital, where a lot of psychiatry and neurology started. So the main issue in French at that time was a lot of hysteria, which was anxiety-related disorders in young female. But then many other neurological problems were similar. So Charcot started these regular daily rounds, clinical rounds, that were attended by many people who later on became fathers of neurology, including Babinski. And then Gowers was considered also the most astute neurologist in time, is a British neurologist, and Babinski was a student of Charcot. So I really like this painting. It's in my YouTube channel and many other places I use it. And this is one of the lectures at La Salpêtrière in France and in Paris. And this is Dr. Charcot standing, and this is Dr. Babinski holding the patient, and they're talking about a lecture on psychosomatic manifestations. It's both psychiatry and neurology happening at the same time. Even Freud learned from Charcot at some point. And if you look at all the audience, these are the people who named a lot of these syndromes. So Dr. Gilles de la Tourette of the Tourette syndrome, Perinaud of the Perinaud syndrome, Perinaud-Foville syndrome, Brissot syndrome, Mary-Foville syndrome, and so on and so forth. This is a Junior Charcot, Duvet, and so on. So all of these later on went on to found various of these syndromes, including especially Dr. Babinski, who we now call as the father of what we consider clinical neurology.